sensor, other than normal RGB camera, it has an infrared sensor which depicts the depth of each pixel in the scene, right? So from a normal RGB camera, we can only see RGB values. Using Kinect-like sensor, we can also depict depth of that particular scene. And then using the RGB and the depth value and the software which is involved right now, you can actually track users' activity. So in a three-dimensional scene, you can actually track X, Y, Z location, alpha, beta, gamma angles of all your 20 body joint parts. By enabling that, in a particular scene, if a user is waving his hand, that waving a hand action can be actually binded with an event in a computer, right? So something like that. So in a human skeleton, you have 20 body joint parts that this particular sensor tracks at 30 FPS, right? So I just have to keep tracking my hand location, and if that hand location is moving into some kind of a parabolic path or something, that particular event can be binded with some particular event in your computer. So let's say I'm moving this presentation right now. Instead of pressing the right and left key, I can just wave my hand in front of the screen, and that can be depicted as next slide, previous slide, zoom in, zoom out, that kind of functions, right? The gestures are actually depicted in 3D, so you don't have to move your hand in a parallel plane. You can move it in a three-dimensional space. So that actually increases the efficiency of this particular system, and you can depict more natural gestures rather than some static gestures or some predefined gestures that are depicted by the system. So all kind of human gestures can be binded to some computer programs, right? Very quickly, let's move on to some application that people have been doing. Gaming is, of course, one of the primemost application for which this technology was invented. People have started making computer application to interact with your computer programs. Instead of keyboard, mouse, now you can interact with your computer programs using your gestures. So changing application, interacting with audio, video data, multimedia data, and playing with virtual avatars. So your system can actually detect your emotions, your body movements, and your body language, and that can be depicted into a virtual avatar, and that avatar can do some other programs in your application. So one particular system that GE introduced, it's called Visible U. Now, see, if you can see in the picture, there is a person, a user standing in front of the screen, and now she is doing some kind of activities. So based on those activities and the motions, you can actually model some characteristics of that person. So cardiovascular activities, muscular activities, nervous system, skeleton, walking style, postures, and all those things that can be easily modeled. Something is which is not really relevant to healthcare, but does actually make sense, is like you can control physical system using your gestures. So in the video right over there, you can see I'm waving at a robotic system which is looking at me, and the robot is just moving based on my gestures. So it's not an autonomous robot. It's programmed to detect your gestures, and based on that, it will move your system accordingly. So we have actually implemented the system into a wheelchair also. So a wheelchair has a Kinect device, and it has its whole programming unit. You can just wave at the wheelchair, and it will come towards you, which is actually a very important system, and people just don't have to control a wheelchair by remote controls or call people and all. You can just remotely control your wheelchairs. In the other video, what you can see is we are using the same robot to develop 3D models of the environment. So I can have 3D models with high fidelity, and that can be used for a number of applications, modeling, surveillance, security, and all. Same 3D modeling system can be also used to model people and objects, right? So maybe as one of the digital health record, I want to model a person who is coming to me, his skin patterns, his physical properties and all. So it can have many number of applications, but having a high fidelity 3D model of a person can have many applications in healthcare industry as well. So let me just... if I move to healthcare applications, one very basic topic that we've been talking about is personal health records. Okay, so you have seen in operation theaters, the surgeons have to continuously interact with the personal health record of the patient who they are operating on. So while even during the surgery, they have to go back to computer in and out, change and browse through number of records, get into different kind of details. But it's not a very healthy system that is in place right now. while operating to a patient, you have to go to a computer, touch keyboard, mouse, which have been touching by a number of people and all, then wash your hand, come back to the patient again. So this kind of in and out system is not really very effective. So what we are actually proposing in a system which is being already developed by a number of people is instead of having keyboard mouse interaction with the system, why don't you just place a big screen right across the operation theater and keep on browsing with your personal health records using your gestures. So normal gestures like swiping through next record, zooming in, zooming out, and then manipulating with n number of records for the patient which is on the table right now being operated can be done just by gestures rather than going to a physical machine using keyboard mouse for that matter. So this is a simple depiction, a picture I have right now. So you see a surgeon just waving natural gestures to a system which has a big LCD screen, a Kinect record, and a computer connected to it. I have a video. So this is a system implemented at Sunnybrook University. Let me just play this video. It's a 2-minute short video.
Thousands of surgeries are done at Sunnybrook every year, and success depends on having a clear roadmap of each procedure.
For all surgeries we do today, really, image guidance is a key to helping the surgeon. It's like having a GPS for your car now.
And now, surgeons like Dr. Law are getting a helping hand from an unexpected source, Microsoft's novel gaming system, Xbox Kinect, which turns the player into the remote control. Traditionally, surgeons remember in that moment the information imaging like CAT and CT scans provide, or they can step out of the sterile field around the patient to manipulate the image on the computer, but that means having to re-scrub. Dr. Law says the application they have built on the Xbox Kinect offers the potential solution to that challenge. The surgeon makes simple and measured gestures in the air and can remain in the sterile field while directly adjusting CAT and CT scan views.
You'll see me controlling the X-ray imaging completely without touching or interfacing with the screen or the mouse. Remarkable. What the Xbox Kinect allowed us to do then is with a wave of our hands, all of a sudden the computer now...
So you basically get the gist, means what is it really happening. In the earlier video where you see me waving at that robot and the robot reacting to some of the gestures, same thing, just by detecting particular set of predefined gestures, you can manipulate with your personal health record, and for the matter of fact, you can start doing any other applications around it as well. There is another application that you can actually do with Microsoft Kinect device. So there is a topic of medical adherence in a prevalent and expensive problem in healthcare industry. You give, so it's basically taking your personal health records and medical feedback that you're giving to a patient and checking if he's actually adhering to that, he's following your prescription and all those kind of a thing. So the question is, how could we use Kinect to improve medication and disease education, right? So the idea is to make it more interactive, as interactive as possible. So rather than just giving list of the items, means giving him some prescription or advices to follow up, why don't you make it as an interactive system, maybe across like a game or something, so that he can follow it up and maybe follow a prescription in a much more efficient way. Right, so this is what we propose is creating an engaging and interactive learning experience. Physician can digitally demonstrate to a patient how the body functions prior to taking a specific medicine. So you can see, I was talking about the virtual avatar thing. You can detect and create a virtual avatar of a patient, and same thing can be recorded. It can be played number of times, and it can be manipulated by doctors or the healthcare professionals, and it can be shown to a patient as per the demand. Now you can show the patient at a time lapse with or without adhering to a proper medical program. You can tell them that your body will react like this, your skeleton will become like this if you adhere to a prescription or if you don't, right? The demonstration conducted using patient's own body results, so it can be personalized, it is detecting that particular person, and the results can be very much personalized. Another system that we are looking at is video conferencing. So privacy is also a much more concern when you're talking about healthcare. There are patients who are doing telemedicine kind of an application. You can have a much more effective video conferencing system where you can play and pause, segment out people who are not necessarily involved in the system, so you can see the privacy zone kind of an application. I can totally remove a person. So again, it's a 3D input sensor. You can very easily segment out people out of it, and the speech recognition is also very efficient. in this particular thing. You can add on some virtual augmented reality object to depict some information out of it. So these kind of add-on applications are also possible if you use Kinect as a vision sensor in your video conferencing system. Right. So that's all I have to speak right now. Any questions we can take after the last talk?
Namaste, good morning. It's been kind of a dull morning, but I'm sure we can learn a lot today. Can we? Pleasure meeting all of you this morning. Sort of started off with what's an electronic record. We heard about the patient health record, the personal health records. Professor Gopal was giving us details on how it's architected. We've seen the mother and child system, the mother system that CDAC has beautifully put together. I am very sure that doing all of this is very simple. It's a cakewalk. The colleagues in the back of my table are smiling. I know they're feeling some pain when I say that. So there are definitely lessons learned during EMR implementation. A lot of what I'm going to say may sound very philosophical, but trust me, it is not philosophy. It is getting to the basics. So the way we look at this problem is, it is not a problem. We got to get over this, and it is done for the betterment and the excellence of the organization. And that is why any hospital system, any health system will go for an EMR implementation. So the implementation of an EMR starts with planning, meticulous planning. Every hospital has its own uniqueness. So you take any market standard product, they're going to tell you, oh, you know what, this is not going to fit into our business model. We need some changes because we are unique.